Good morning and welcome to our weekly live question and answer series where I sit with Dr. Elthorpe, usually an integrative medical physician, and we look for questions from you, the audience, to ask the doctor about health, wellness, prevention of disease, really anything. The great thing is you don't have to be a patient here at the office. You can tell your friends and family about this and post your questions in the chat section of YouTube here off to the side of the video. And you do need to be logged into YouTube to do that. If for some reason you're having trouble with that or you can't get logged into YouTube, that's fine. You can email your questions into us at office@tlcdoctors.com. That's office@tlcdoctors.com. Put in the subject line something along the lines of questions for live YouTube Q&A, something like that, and it will be forwarded to me, and I'll make sure that we answer those questions on the following week's episode. Quick disclaimer, this is for information, educational purposes. This is not meant to replace your relationship with your physician. We want you to make sure that you follow up with your specific health plan with your doctor. Of course, we're here in Orange County, California, accepting patients, both new and existing. So you can book an appointment with us here, but do make sure that you follow up with your doctor. Well, Dr. Elthorpe, thanks for joining us again today.
It's always my pleasure. I was wondering, Talon,
Yes.
could they even text our phone number at 714-544-1521 and text us a question?
You sure can.
All right.
Yep, those questions also would probably be answered on the following week, but because the front desk is answering those questions, but they do send me questions from there as well.
Okay, very good.
So you can text us as well. If you're on your phone right now, text us at 714-544-1521 and just make sure that you make it clear that this is a question for the YouTube. All right, with that, last week we had a lot of questions come in the chat that we did not have time to get to, so I think we'll start there. Just want to mention too, you might notice a bit different background here. We'd missed a couple weeks. We've been doing a lot of work here at the office on how we can provide better care, and one of those things is getting a better office here for the doctor and for YouTube. So that's where we're at today, in the next room over.
Thank you.
All right, so I'm going to jump into questions from last week from the chat. Let's see here. Okay, so we had a question. Dr. E, would you consider using DTPA for gadolinium chelation, possible via a DTPA suppository trial for gadolinium toxic patients? Thanks.
There are many chelating modalities. Even glutathione over the counter helps with detoxification. High dose vitamin C helps. Chlorella. Other items that would be helpful in the natural realm over the counter. But as far as them having reproducible science showing a pre and a post chelation, this becomes questionable. R-lipoic acid has also been used. There used to be a product, it might be out there, it's called Metal Free, which is a very concentrated alpha lipoic acid. Then there's DMSA, DMPS, and then there's EDTA, then there's penicillamine. So there's an entire host of chelating agents out there. I believe we need to chelate to reduce the heavy metal bioaccumulation that we get from just breathing the air,
Right.
from the geostratospheric engineering and them dumping these cloud dusts that have aluminum, strontium, and barium oxides in them, maybe other things. And this lands everywhere and on your organic ground, and this is drawn up into your organic vegetables. So we're bioaccumulating heavy metals all the time. So any way in which you can try and reduce this, I am in favor of.
Right.
However, as far as recommending efficacious, reproducible, science-proving reductions,
As well as long history of safety.
as well as long as it's safe, I'd have to stand for EDTA chelation as the widest, most broad spectrum, most knowledgeable, most multi-dosed, universal, worldwide given chelating agents, safe enough even for children and toddlers who accidentally imbibe or ingest little chips of lead paint and become neurotoxic from this and systemically toxic. So I'm in favor of these things. If you have a clinician who can put some DMP DMSA into this, but these are prescription items, okay?
Right.
And you have to get a doctor to do that. Now, I did the research involving the EDTA suppositories, and we published that. We did the pharmacokinetics on it. We did the human studies on it, and so I am always going to stand with EDTA chelation.
Right. Great. Good answer. I hope that answers your question. And gadolinium, of course, is a heavy metal that we see a lot used for imaging studies.
Right.
So
it's a contrast. Heavy metal is a contrasting agent used in all these imaging studies, and I see very concerning high levels in many of my patients. And even physicians are just ignorant of how this is bioaccumulating for every scan they do.
Right.
So I'm here busily helping my oncological patients, my other patients, with trying to support their therapies from their oncologist, but at the same time detoxifying them from the accumulation of gadolinium.
Right.
I have a wonderful paper on that. If you go to my tlcdoctors.com and you look on the blog, you'll see rationale for using EDTA in chronic diseases, and in there I'm citing paperwork that talks about the reduction of gadolinium because it's so neurotoxic, and I reference a paper that was done almost simultaneously when I was writing mine from a nephrologist who saw the terrible buildup of gadolinium and how EDTA chelation was so beneficial to nephrological diseases and chronic kidney failure.
Right.
And things like that. So read my blog on that, check it out, look at the references on there, and you'll see one titled The Neurotoxicity of
gadolinium.
Gadolinium.
Right.
Yeah.
And of course, imaging studies are necessary sometimes
Yes.
to look for something, to monitor progress. So it's a necessary evil, but it is a toxin, and the body has no need for gadolinium. So that's why when we have patients that go in for those imaging studies, CAT scans, PET scans, MRIs, we want them to come in and chelate as quickly as soon after.
And thank God we have EDTA chelation with 60 plus years. And remember, the American Academy for the Advancement of Medicine is the premier original doctors coming together for looking at alternative, complementary, integrative support for their medical therapies.
If the mRNA vaccinated person donates blood, is there anything transferred to the blood recipient? I don't think we know the answer to that
yes.
yet. That's theoretically.
Yeah, I'm answering this in theory because there's really no published science that I'm aware of, and I have looked into this. So I've listened to several commentaries by physicians in virology, in immunology, and in infectious disease. And I haven't seen the American Heart Association or the Blood Cross put out any restrictions on donor. Not FDA approved. It is under emergency use authorization, so that's where it should sit right now in our purview of what it is. And it is a technology that is uncharacteristic of the history of vaccinations, in that this technology medically inserts a messenger RNA for seizing your intracellular machinery, your ribosomes, to produce this about being near a person who was vaccinated and started to experience irregularities in her menstrual cycle and in some skin rashes. And so we have to look at this with caution as well.
Okay. Next question would be, could you please name the blood types and give a short contrast of how the blood type affects a person? I've heard you mention O is very good at digesting protein, for example.
Yeah, nose and throat and eating and swallowing. Now, your blood is...
It's like a predisposition or a stereotypical way to classify common issues that we see and advantages.
The A-type blood, as I've always said, has a low, it'd be in contrast to the O. The A's as a class don't digest as well, right, even from infancy. Mm-hmm. And these are the colicky kids, the kids with lots of early onset rashes, immunological, to handle food coming at them. They're in a state of alarm in their immune system, and then they react to their environment more. And then B-type blood has more of the allergies. You can say the B blood, sneeze, itchy, teary. They're just very sensitive people. Now, in no way does this define anybody long term.
Right.
I'm a B positive. I have horrendous allergies, but because I know this, I take natural antihistamines all the time. And in the world, if they learn to avoid this early on, then they tend not to get these arthritises and ulcers and so forth.
Right. Okay. And the book, Eat Right for Your Blood Type, do you find that to be congruent with what you found?
I do, but I want to state cautionarily, we are too unique of a people to just classify a person by a blood type.
Right.
It's another
a piece
indicator.
of the puzzle.
It's a piece of the puzzle,
Right.
and your clinician should have this knowledge in approaching you holistically. So I don't believe in having a vitamin series designed for A-type blood, a vitamin series for B-type blood.
Design.
Yeah, a diet designed for them. Because if they learn to use digestive enzymes, for instance, in the A-type blood,
this week. So Jennifer asked, I can't remember if we answered this or not, when recovering from a medical condition that caused weight loss and trying to regain weight, what are some examples of healthy carbs that can help with the need of weight gain? Did we answer that last week?
Yes,
We
I
did.
think we did last
Okay.
time. We were talking about the complex carbohydrates using
Yams, sweet potatoes.
and very heavy, healthy fats.
Yes.
Because there's 9 calories in
or
the
fat and proteins. Yes, we did talk about this.
So good fats, lots of it. Remember, I'm on the carnivore diet, and I think I'm on about 75% of my diet is fat.
Yep.
Mhm.
Okay. I had a chest pain mainly in the middle of my chest. I was told by my gastro that to get an endoscopy done. Is there anything I can do to get the endoscopy? No stomach pain. Can I do to avoid the endoscopy? I'm sorry, it kind of broke.
Diagnosing chest pain as a stomach heartburn reflux disorder. But once you've ruled out any cardiovascular disease issues there, then talking straight about pain due to the gut, stomach, esophageal junction region, then you have to understand the esophagus does not have a fascial sheath lining. And what do I mean by that? Your lungs have a pleural lining. Your spleen and liver have a peritoneal lining on it, a fibrous kind of like capsule, you might say.
Right.
Your intestines have a coating on them. So we have a dural membrane around our brain. But interestingly enough, our esophagus does not have extremely acidic or a Coca-Cola, which is a 1.5 to a 2.0 pH. And then you start burping that up into this esophageal region. That inflammation will alarm the lining smooth muscles of the esophagus, literally right through it to the pericardium, the pleural areas, as well as the musculoskeletal areas in this region.
So basically that inflammation, that irritation can spread to the other parts of the body.
Yes. And so what we recommend, of course, is never eat late past 6:30 at night. Number 2, if you are A-type blood or if you're over 50, you probably need digestive enzymes. Hours easily burping up when you bend over to tie your shoes. We recommend using something such as L-glutamine powder, Glutagenics, GlutaShield. These are simple L-glutamine which are very helpful in the repair and lining of your entire stomach and esophagus. So enzymes, glutamine, then there's other things that help us, like aloe vera.
Right.
You could swallow
and the
that.
GlutaShield has aloe,
Yes.
glutamine, and licorice in it.
Yes, yes. So that's what I would recommend doing. And yes, you could get onto the phospholipid repair. So I'm very well published in that. Every cell lining has a double biolipid membrane. And those phospholipids are in the fats, and we haven't been eating enough fats.
Right.
And so if you take NT powder along with GlutaShield, or what I call SBI powder, SBI Protect, these are little mixtures you can drink first thing in the morning, last thing at night, and then make sure you don't eat late. And that tends to heal this up very nicely. And that's what I do for my patients to try and avoid needing further investigative interventions.
Right. And just one other idea, while we really push water and we find most people are dehydrated, not drinking enough water, you can actually cause a problem if you're eating a big, especially protein.
It will dilute the acidity, which is intended to be there to help break down what you just ate.
Sip water while you eat, but then guzzle it outside of meals.
Right.
Okay, now let's jump into some questions that are coming in live in the chat. Jennifer asks, what is your opinion on essential oils? I'm considering frankincense oil for breast cancer.
It has to be driven by science for me as a physician to give my opinion on that. Now, anecdotally, in 40 years of medicine, I have seen a lot of anecdotal patients come that have full in a variety of disease states. The specificity for cancer, of course, where's the science on this? So I am not against it, okay? But I don't have enough science to say I'm for it. I have enough anecdotal experiences with patients who seem to attribute at least part of their improvement from things such as that. And so I would have to stay neutral on that. I'm not against it.
Right. Unfortunately, there just hasn't been enough research, and there's really no money behind doing research on essential oils as a adjunct to certain disease states.
Right.
But probably beneficial. I can speak from experience using essential oils in a humidifier or even topically or sometimes in water. Some things are very nice for calming, relaxing, even digestion. And I know the company doTERRA has really high quality organic essential oils. And usually people from that company can point you in the right direction of which are associated with.
There's another issue called the placebo effect.
Yes.
Whenever you take something, you're already you're anticipating an outcome from something, and you're putting in yourself in a state of compliance.
Right.
And so when people come here, they're already healing in the sense that they're making a decision to work on their diet because they know I try and use natural things before I have to resort to pharmaceutical things. So that's what science is all about. That's what peer review is all about. That is what scientific, always asking a question, why, show it, prove, what if, and so this
and then
is
reproduce it.
Exactly. Yeah.
Now that interesting enough highlights part of the challenge with being a working doctor and being a doctor that is passionate about the research, because here in the office when you have a patient that comes to you, you want to do as the best possible to heal them as quickly as possible, as effectively as possible. So you're going to change their diet, you're going to modify their water intake, you're going to put them on vitamins and supplements that are evidence-based. You may or may not put them on prescription medication. You'll work in conjunction with their specialist or their oncologist. You will do a multi-system approach, and then what happens? Our patients get better. Their chronic diseases reversed. Their cancer is goes dormant or goes away. And then the question is, well, what did it? Was it the supplements? Was it the IVs?
Was it the delayed effect of the chemotherapy? You know,
so it's really difficult just to point our finger at one thing as doing it when we know that all these things work together. But on the research side, you want to isolate everything. You want double-blind, placebo-controlled, and try one thing at a time and see what it is. So that's the challenge in this type of medicine.
Right. And ethically, you cannot look at just one item if you know it would be to the detriment if they didn't do other things. So you would never isolate out their needed chemotherapy or surgery needs or whatever. So it's a very challenging issue.
It is. Okay. Regarding digestive enzymes like orthodigestime, is it okay to take them immediately after a meal instead of right before?
Oh yes, absolutely. In fact, I always take mine after eating. In fact, if I have forgotten, even 2 or 3 hours later, I still take my digestive enzymes, yes.
Okay. What are your thoughts on the Novavax COVID-19 vaccine currently under stage 3 trials?
Yes, that's something I need to look into. I have not looked into Novavax. My understanding of it is more of a traditional type vaccination, where as these new Pfizer, Moderna, Johnson & Johnson, AstraZeneca, I went to the meeting at the Board of Supervisors yesterday, and I spoke before the Board of Supervisors. Fortunately, they agreed, and they did not go towards requiring vaccination proof for entrance into businesses or sports or whatever. But so I'm very, very busy, but I still have that on my to-do list, so I'll have that next week.
Okay.
All right.
Well, thanks for your honesty. We don't know the answer to everything all the time. Okay, I had a question emailed into us by Damien, who asked, does collagen help repair herniated or bulging spinal discs? Would your collagen powder from
help any disease? Would water help any disease? Since your discs have collagen and in it, of course, we certainly would say yes, it would. But as an individual therapeutic intervention to improve low back pain, there's really no consistent or evidential research that I'm aware of. Now, what I would certainly say, what would I do for back pain? I would do something like Pilates. As long as you've seen your orthopedic, we're not talking about some serious sciatica or neurological damage, but for common garden variety back pain, I would certainly say hydration is they didn't see any improvement, okay? Number 2, enzymes. God always uses systemic enzymes as an anti-inflammatory, pain relieving, debris removing, allowing repair to occur. So systemic enzymes. And so if I hurt my back or any part of my body, I will take double or triple the amount of enzymes for 2 or 3 days.
Right.
Now that's not a digestive enzyme, so that's a systemic enzyme.
Right.
I'm taking on an empty stomach, so it'll go throughout my entire body. And so I'll take in anywhere from 10 or 15 Vitalzyme or Vascuzyme twice a day, usually first thing in the morning because I don't eat until about 1. And then last thing before I go is helpful would be things like doing Pilates, stretching. Go to Pilates and get the dynamic total body range of motion. You need to build body tone and so forth. That's what I would do. Now, I'm not against taking collagen. We actually have collagen. I actually have a variety that is peer-reviewed by orthopedic surgeons for cartilage and knee enhanced repair over a period of 6 months. But you have to faithfully use it. And remember, cartilage is avascular. No blood supply goes to your cartilage. I did a whole lecture on that on my YouTube series, Tustin Longevity Center, about you only have this little synovial artery in there with cartilage, that in a powdered form, that this is helpful.
Right. Orthomolecular Products has the collagen
and Chondroflex,
and Chondroflex, as well as
which has the glucosamine sulfate,
Right. And we don't carry it here, but we can special order. They have something called the soft tissue repair pack that puts together several of these products from Ortho into a little daily sort of multi-pack.
Right, and that's talking about the amino acids, proline, and such that are important.
How is the Ganadin BC30 in Doctor's Nutrition Bar different from usual probiotics?
Well, this is a spore-based probiotic, and spore-based probiotics are yet another team of good beneficial bacteria that support the entire microbiome. So there are those who would say there's more cells in the gut of viral nature, bacterial nature, fungal nature, than the number of cells that make up your body. So what are you really, a human or a
collection of bacteria and viruses?
Right, we're going around.
Yeah.
Ganadin
BC?
Yeah, this product is a spore-based, pronounce it again?
It is Ganadin BC30, and that is the trademark name of the spore biotic.
Yeah, Ganadin BC30. I always mispronounce Ganadin. This is one of a family of spores that are very beneficial in your immune health, in your digestive state, in supporting healthy production of other vitamins and nutrients that even your gut helps symbiotically provide for you. So it's a wonderful product. Good research.
Last question for today. If you're on a only meat diet, the carnivore diet that you're doing, what do you do for fiber to be able to not have a problem going to the bathroom?
That was always argued, and that's not a problem. Yeah, again, fiber is non-digestible plant cellulose, okay? And there is actually normal, regular formed bowel movements on a total carnivore diet. And so the absolute need for fiber is not an issue on this. So,
of course, drinking enough water and
Yeah.
taking your enzymes,
Right.
digestive and systemic,
Yeah.
are going to help with that.
Right.
I know when I'm drinking consistently every day, the water that I'm supposed to be drinking, I don't have those digestive bathroom issues. Just doing that alone.
Right.
And I know you're drinking your water every day, so
Yeah.
that's great to hear. You're not having any issues.
No,
like that.
no issues with constipation. But you know, I'm so satiated with like one big thick steak, maybe a 10-ounce steak,
Yep.
ribeye or T-bone. I'm really not hungry for anything else. And so my volume of bowel movement is less
Right.
than when I had a high fiber complex carbohydrate diet.
Right.
And I just feel so much better overall.
Awesome. Well, we got through all the questions today. How about that? If you found this useful, if you're finding this series valuable, would you do us a favor and like the video, subscribe to the channel? You can also publish your comments under the video, ask us questions there. We monitor those, and that gives us feedback on what's working, what you like, and what you would suggest for future episodes. So I want to thank you for joining us. We're here every Wednesday at 9:45 a.m. Pacific for about half an hour. And tell your friends, tell your family about this. Get your questions ready, ask them early so we can get to them. And we look forward to seeing you next week, everybody. We'll be here Wednesday at 9:45 a.m. Pacific. Thank you, and be well.
Thank you.
Great.